All right. Question number 1.
What vitamins should I really be taking? Like, just give me one set of vitamins. I cannot be taking 20 pills a day. Like, just tell me the one.
That's a loaded question. So in the 25 years that I've been practicing medicine, when I get those kind of questions, that, number one, there isn't a one size fits all. Most of the foods that you'll have in a standard American diet are fortified with all the things you need. So you wouldn't necessarily need to have anything in addition. One thing that doesn't is things that we get through sunlight. And because of the fact that we don't get a whole lot of sun exposure, most people these days, especially the further we get away from the equator, will have low vitamin D levels. So if you were to say like, well, what specific things, I would say number one, if you're not necessarily eating that great, then just a standard multivitamin would help. But number two, probably even more importantly, would be to make sure that you're getting proper vitamin D in your diet, even to the point that I generally recommend most people to supplement with vitamin D. So if you were to ask, like, say, like, hey, what are just like stop, ask, like, whatever, don't worry about all the other things and all the other weird fad dieting things that I'm doing, I would say vitamin D and a multivitamin, and you're set.
How many calories do we need as a human to consume, on a daily? What do we need?
That's a great question. So, again, if I'm sitting around multiple people and they ask me how many calories they need to consume, I would go back to what are the things that they're trying to achieve and where are they at. If I'm somebody who's overweight or obese, obviously I'm going to reduce my calories and I'm going to look at what is my calorie needs for myself. And I'm looking to increase my muscle mass, I'm going to increase my calories that way. Your total calories is made up of 3 main parts. That's going to what we call your macros: protein, fats, and carbohydrates. One thing we do in the office, of course, is we do this, what we call an RMR test or a metabolic test, and that individualizes it. We were able to then, through this testing, find out exactly how many calories you need, and then we can go back and then take a look at your macros and make it customized for that individual.
Basically how to permanently lose weight without like a surgery and all this extra medication.
If I had a nickel for every time I heard that question, like, hey doc, how do I lose weight and how do I lose it permanently? So listen to your body. Don't overdo it. Everything in moderation. If we say a female should be taking anywhere from let's say about 1,300 to 2,100 calories, or male 1,800 to somewhere around 2,500 calories. If your goal is to lose, you'd want to actually drop it about 500 calories per day, and that will get you on the right path. So that way you're not starving, you're not feeling like groggy, your brain isn't feeling like you're in a fog because you're so hungry. And you want to do about 180 minutes per week in general of some kind of activity where maybe you get your heart rate up a little bit. And again, we can get very detailed, but for the most, average Americans who are not trying to, get trained for a specific something, it's 180 minutes, meaning the equivalent to about close to about 3 hours or so per week of getting up, getting your heart rate moving a little bit and doing some activity. If you really want to get technical, we can come on in, we can put you through a whole thing, calculate out and give you a specific meal plan. But again, for most people in general, just try to listen to your body and restrict the calories. Make sure you're staying active and you should be good.
I would probably ask them, what's the best way to go about figuring out your symptoms besides Googling? Like, if you don't have a healthcare provider that you can go, or PCP that you can go to, what's the best way to connect with them, or,
First of all, I would say that, again, if you don't have a healthcare provider, start with that, right? Let's get somebody in there. I think that people underestimate why we have primary care physicians in the first place. You want to make sure that you already have somebody in line that you can go to, that you trust, they've built a relationship, they have a history there, so you can get that information as you need it. Dr. Google, we've talked about that forever. How can you trust it? Because there's now so much information. And now you're getting even AI into the mix. Now you're going to get all of this information, and we see so many patients who will come in after they've researched things and they're like, oh, I can have cancer. Sure, it's not probable, but it's possible, because there's going to be a whole list of things that are going to be possible. Great question. My advice, got to get in, get yourself and establish a primary care home, or if you need assistance, we're always going to take care of you.
What do you do to stay healthy as a medical professional, I think?
I love that question. For me, it's one of the things that early on, but even my whole life, I've always been very into nutrition and health and exercise. So I'm one of those, up at 4 a.m. I do an hour of cardio, whether it's outside, if it's the weather is, it permits, or whether it's on a treadmill or an elliptical. And then I'll do about 30 minutes of weight training. And that's 7 days a week for me. I'm also neurotic about the foods I eat, and I'm very neurotic about the macros and the micros that I take in. Again, I don't expect everybody to follow that same thing, but I always kind of think to myself, if I don't practice what I preach, how can I expect my patients to practice what I'm preaching to them? So again, for me, that's a critical thing, and I live and die by it.
Do we actually need
man-made medicine or they're natural remedies and you just don't want to tell us because big pharma.
I agree.
You know, it's one of the things that unfortunately there's this perception that we as physicians are just like, you know, brainwashed by big pharma, and I want to say, like, if anything, quite honestly, it's kind of the opposite. Our whole medical school and, you know, medical training journey is always set behind the rules and the premise that everything should be evidence-based and it should be backed behind data, and you should question all the data and you should question it in 1,000 different ways. But the majority of the time when I'm in the room talking with my patients, it's really more of like, hey, this is what you need to do to get yourself healthy. And it usually means, and it usually involves a discussion of like everything but medication. And in fact, I usually try to tell patients, like, I'm on the path, like, even when I have to put down medications, it's like, how do I get you off this medication? Like, let's work together to get you off the medication. I always tell the patient, hey, listen, you either do it for yourself or I have to do it for you. The only other way I can get you under control is I got to put you on medication. I got to put you on insulin. I've got to get you on some other stuff. And then our goal is to get you off of it. There's nothing more that I want to do to get my patients off of medications. But again, that's always our goal, is to keep you off of medications. And it's really on you to help us with doing that.
Does Ozempic really work?
Well, that was straight to the point, right? So, does Ozempic really work? So yes, it does for certain populations. And again, and it all depends on what do you mean by does it really work? If you were using it for diabetes, right, then yes, it does. We use it as a GLP-1 to help with patients when they're exhausted, diet, exercise, and change in lifestyle. What I think this gentleman is trying to get to is, does it work for weight loss? You can get weight reduction from it. It absolutely does work for a portion of the patients who take it, but not everybody.
I'm female and I'm up there in age, so I would ask about these midlife hormone changes and the hormone shifts and what that means as far as exercise, diet, and how things need to adjust, and how things that you previously had done in your 20s and 30s no longer work for you.
Wow, that is a great question. Yeah, so it's one of the things we always talk about and why you need a longitudinal healthcare provider, because things happen over time. And this is a great case in terms of men and women as they age and our body changes. All of us are going to start going through this now initial decline because hormone levels now start to drop. When those hormone levels drop, everything in our body starts to change. And we need to start preparing for that, right? So that's why when we're talking to our 30-year-olds, we're helping them to prep to be a 40-year-old. And when we're talking to our 40-year-olds, we're telling them and what they need to do to start prepping when they're in their 50s. So a lot more surveillance that needs to happen. And there's a lot more that we can do now, thank goodness, that we can actually do because we can have bioidentical hormones that we can start to do the replacements for. We partner with our OB-GYN and our in-house team to make sure that, again, we're individualizing it for those each patient. And when they hit those certain numbers, we can start giving them options and not have it so that way she's feeling the way she does.
Hey guys, I love these questions. They're fantastic. All these questions were right on. In 25 years of practicing medicine, I gotta say, I hear these questions all the time. If you want to come on in, see one of us at epichs.org. Again, that's epichs.org. We are national. We've got locations all throughout the country. These kind of questions, we love our patients to come in. That's what we're here for. Whenever you have any symptoms or ailments or anything you're not sure of, come on into the office. One of our providers, we're always there. We're always happy to see you. Again, it's epichs.org. We'll see you soon.